medical colleges of Northern Philippines. And for verification, may I know your name and your age?
My name is Rodalyn and I am 19 years old.
So for today, ma'am, I will be assessing your respiratory system, particularly your thorax and lungs. This is to assess any abnormalities or any problems in your respiratory condition. Is that okay with you? Then next, help the patient undress if needed and then provide a examination gown. So let's just assume that the patient is already wearing her examination gown. And then next, assist the patient into a sitting position and then expose the posterior thorax. So the first thing that I will be assessing is to inspect the posterior thorax. So I will inspect for the skin, bone, muscle of the spine and back, as well as the symmetry of expansion and the accessory muscle used during respiration. So I will be inspecting that. Ma'am, can you do inhale? So I observed that there is no skin discoloration and there is no presence of any lesion, there is no bruises or cuts. And then for the bone, there is no presence of any curvature, there is no presence of any lordosis, kyphosis or scoliosis. And for the shoulder blade, alignment is normal. And for the symmetry of expansion is normal also. And lastly, there is no use. She doesn't use any accessory muscle during respiration, and that is normal. So next is I'll be assessing the anterior, posterior, and lateral diameter. So the ratio of her anterior, posterior, and lateral diameter is 1:2, which is normal. So next, I will be palpating the spine and posterior thorax. So for the temperature, I will be using the dorsal part of my hand. And for the areas of tenderness, muscle development, and masses, I will be using the palmar surface of my hand. So first is the temperature. So your temperature is warm, which is normal po. The next, for the areas of tenderness, do you feel any pain, ma'am? Dito po. Dito. So for the areas of tenderness, as verbalized by the patient, there is no pain on the posterior thorax. And for masses, there is no presence of any masses here. And for also the muscle development is normal. So next is I'll be assessing for tactile primitus. So in this assessment, I will be using the ball of my hand because this is sensitive to vibration. So I'll just allow the patient to say the word 99. This is to assess any decrease and increase in lung density. How many please say the word 99? So for the tactile parameters is normal because I feel vibration equally and bilateral. So next is I will be assessing for the thoracic expansion. I'll just put my thumb in between the spine of the patient in level T9 to T10. Ma'am, can you inhale and exhale on the count of 3? Inhale. 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 So for your thoracic expansion, ma'am, is normal because my tongue expands within 3 to 5 centimeters. The next thing that I will do is to percuss over the posterior thorax and lateral lung field for tone using a zigzag pattern. So I will note for intensity, pitch, duration, and the quality of sound produced. So I will also percuss for the diaphragmatic excursion on the both sides of the posterior thorax. So your lung sound po is a resonance which is normal. For the next assessment is to auscultate the lungs across and down the posterior thorax to the bases of the lungs, as the patient breathes slowly and deeply through the mouth. Ma'am, can you please open your mouth and do inhale? On the count of 3, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, inhale, So for your breath sound po, it's normal. I don't hear any stridor, ronchi, crackles, or any abnormal breath sound. So next, I will be examining the anterior thorax. So I will assist the patient in a sitting position and rearrange the gown and expose the anterior thorax. So just like what I did on the posterior thorax, the first thing that I will do is to inspect for the skin, bone, muscle, and the symmetry of expansion and the accessory use during the respiration. And the accessory muscle use during respiration. Then next is to palpate the anterior thorax for tactile primitus. Next is to percuss over the anterior thorax. And the next is to auscultate the anterior thorax as the patient breathes slowly and deeply through the mouth. Then I will inspect for the breast and axillae with the patient hand position on both sides of the body. Place on the hips and raise above the head. The next, I will palpate the axillae with the patient hand resting against the side of the body, and then I will assist the patient into a supine position and then place a small pillow or towel on the patient's back, and then palpate for the breast and nipples. Wear gloves if there is any discharge on the nipples, or lesion is present. And then lastly, assist the patient in removing her examination gown and then perform hand hygiene. That's all for the anterior and posterior assessment of the thorax and lungs.